let's go to the big questions now. Will the vaccine drive therefore take off now? How can we resolve the vaccine hesitancy? Has India's vaccine drive lagged behind? Should the vaccine be opened up just for everyone now? Is the private sector's role adequate? Can it be enhanced even further? Joined by Dr. R. Gangakhetkar. You might remember him, the man who was at the ICMR at the heart of the fight against COVID. Epidemiologist, former head scientist at ICMR, Dr. Ashok Seth, Chairman Fortis Escorts Heart Institute, one of the country's top private doctors. Dr. Shashank Joshi, member COVID Task Force Maharashtra, a key state in this fight. Dr. Rajesh Parikh is Director of Medical Research and at Jaslok Hospital. Appreciate all of you joining us. I want to come to you, Dr. Gangakhetkar, your first reactions to this drive. Do you believe, Dr. Gangakhetkar, that the vaccine hesitancy will now be overcome now that the Prime Minister has taken it, other leaders have taken it? Is this going to give the vaccine drive, you believe, some impetus or not?
Absolutely. It has to give impetus, because there is one thing which we have to remember, that throughout the entire process, there was criticism that we don't know anything, there could be side effects that may emerge out of taking vaccines. And when your own Prime Minister comes out in open, he takes the first dose by himself in the third wave itself, you would perhaps think that there is no reason to worry about these side effects at this juncture. Right. Because if side effects were to occur, he himself is 65 plus. He is at the helm of one of the largest democracies in the world, one of the powerful nations of the world. He would not have at risk, or nobody would have allowed him to risk his own health.
But maybe he should have taken it, if I may play devil's advocate, a month ago when the drive was started. Better late than never, you're right. But maybe he should have just kicked it off, because when I look at the drive for health workers and frontline workers, there has been a high level of vaccine hesitancy.
No, I agree with that part. No, but I would only say one thing. Don't you think that it would have been, it was unrealistic to expect? Mainly because when you lay down a certain principle as to who would be prioritized, it had to be a healthcare worker or a frontline worker.
Fair enough.
He was falling in the third category. So I don't see any issue with that. In fact, it also means there is an access related to equity within prioritization as priorities that tend to come, rather than what it would have been otherwise.
Okay, fair point. I want to come to you, Dr. Seth, on the issue of private hospitals getting involved. We saw in the first stage, many of them either willingly or unwillingly were kept out of the process. Do you see them now getting more actively involved in the process? A number of them are listed on the website. Virtually every top hospital across the country is listed. But do you see them getting actively involved? Is there an incentive in any way for private hospitals to really get involved?
So let me just first say that this is absolutely correct. Private hospitals are keen to get involved, keen to augment and enhance the vaccination drive. And I tell you, you just said, what is in it for the private hospitals? I think you've seen this in the past, and even till now, the private sector has stood shoulder to shoulder with the government in the fight against COVID. Not because of any profits.
So I'm sorry to intervene, there's a question mark over that. There are a number of people who believe private hospitals could have done much more. And even today, given the fact that it is not a priority, it's not as if you're profiteering from vaccinations. Correct. So can we expect private hospitals to really make this a priority issue?
Absolutely, and this is what we did today. We're seeing how this can be even ramped up. For example, there are two aspects to it. Nationalistic feeling, we're doing a job, we're doing a service, and we're happy that the government trusts us. Now, we must remember, what is the profit into this? If we actually are able to defeat COVID, and by the way, we are at war, and we've done that, and we've stood shoulder to shoulder with the common sector in the last 1 year, even till today as it stands. So if we've done that, we've done it for the sake of the country. And believe you me, the biggest profit the country can have is to drive away COVID, for normalization to occur and everybody to gradually get back to normality. What could be a better thing than that? So, by the way, the trust between the government and the private sector have gradually dwindled. You remember that time when we actually only had the testing only in the government sector, and then gradually it was open into the private sector. And apart from a few glitches, everyone's worked together to the fight against COVID. So we're actually saying we want to ramp it up, we want to do more and more. 250 rupees is not our issue. That's clear. You've not seen one question raised on the 250 rupees issue. What we're saying is, how can we do more? How can we actually get the big... By the way, on one hand is the hesitancy issue. And by the way, the hesitancy issue is a very complex phenomenon. But also, there is still loads and loads of people, which I get calls of at least 100 patients a day, who says, when are we going to get vaccinated? How do we get vaccinated? And there is no hesitancy. So the hesitancy is a complex phenomenon of complacency, of convenience, and of confidence.
I'll also
some of these happen over a period of time.
It is also some belief about whether the vaccine should be opened up to all. And Dr. Parikh, do you believe that this is the moment to open it up to all? Those who can afford it should perhaps have one track. Those who desperately need it and have gone through the registration process and needed to, because of economic conditions, needed free, are on another track. Open up the vaccines. Open it up in a manner that many more people can avail it who want it desperately. Why have this slow top-down process? Decentralize it.
Absolutely, Rajdeep. Always a pleasure to be with you. I couldn't agree with you more. In fact, mid-December, we wrote out a policy paper about the second wave, an incipient second wave, in which, these are some of the recommendations we made, that the vaccine should be opened. A large component of our country, I believe 60 to 70%, go to private healthcare in various capacities. And yes, it's about time that it should be opened up. But if I may just add, I've thoroughly enjoyed the discussion you've had so far, particularly your discussion with Mr. Sharma. And, he said something interesting. He said it's not as if we are in a village, but, we are with technology in a global village. As, Marshall McLuhan, in his classic work in the 60s, The Medium is the Message, said that technology would take us to the global village. And I think we have entered the global village perhaps 60, 70 years after McLuhan predicted it. And we have to think of ourselves as a global village if we are to deal with this pandemic effectively.
Can I come to you, Dr. Joshi, because you're a member of COVID Task Force Maharashtra. Today there were long queues outside several hospitals. So there's a lot of excitement. I know my own, that there are relatives of mine above the age of 70 who are very keen to get the vaccine. So there were lots of queues outside hospitals. Are you in a position to cater to that? Do you believe that these are only teething problems, these long queues, 3 hours, 4 hours, senior citizens waiting in some parts of Mumbai for the vaccine?
Ajib, it's a very positive and exciting time. I'm very happy that people are coming out without hesitancy. The Prime Minister has given definitely an impetus, and I agree with you that he could have given it much earlier. At the same time, we can also get into a situation of pandemonium. You raised some very crucial issues of equitability, affordability, access, and overall market access to an affordable sector. All this has to be done extremely mindfully, extremely carefully, in a way and in a manner where public and private partnership can be coming up in a war-like situation. I think the need of the hour is an exponential increase in the vaccination to the vulnerable group. To answer your question whether everybody should get it, I think right now our first target is to save lives and vaccinate those who are most vulnerable to get or succumb to the disease. I think that is why the first target has been set of that magical number of 25 or 30 crores. Actually, the number has narrowed down because that 27 crores was calculated for people above 50 and comorbidities below 50. Now, actually, they have narrowed that number down. So nobody has actually made the computation of that 27 crore. Right. How much of that has come down? So actually, they have narrowed their own target because I thought they could not meet that target. So now they have made it above 60 and the comorbidity between 45 and 60. Nobody has discussed that. It's time that some people put some math on it and get some numbers, whether that 27 crore has dwindled down to 22 crore or 23 crore. And obviously, we need to get those protected on a priority. After that, equitable distribution across private and public sector should be done.
So you're saying that is the final stage. You're saying at this stage, this is the stage where to target those who are most vulnerable. That's the critical question. Dr. Ganga Khetkar, when we say most vulnerable, we've seen a number of young people also who've succumbed to COVID. We've seen people with comorbidities, and there are those who are saying the definition of comorbidities needs to be clearer. In terms of registration, if you've had high blood pressure over a decade, for example, you could take the vaccine now. We've seen a number of young people who necessarily may not have even had comorbidities succumbing to the vaccine. Should we, I come back to it, therefore open up much faster, sir, to all those who want to take it?
I would be little more circumspect in saying that it should be open to everybody. Whatever decision that has been taken, when we say persons with comorbidity or old age, they have a higher risk of death, that is based on scientific evidence. Now, when we know that these people are more likely to succumb to COVID-19 infection because they tend to get severe COVID infection, perhaps this is something which is not so easily deniable. If I look at stray cases that tend to occur in a population which doesn't have comorbidity or they are younger than 60, then those are not frequently occurring event. If we tend to say that everybody should be receiving vaccine at this point in time, we might lose the focus. We might lose an opportunity to ensure, because in any case, none of us have so many vaccine dosages available that you can perhaps think in terms of providing vaccine to all 135 crore people, assuming that all of them are important and they have to receive it. So you need to prioritize in this process. You need to reduce the risk of death as much as possible, as quickly as possible. If people actually start taking the vaccine very quickly, and if we are able to scale up the vaccine drive dramatically, then perhaps even that opportunity will come that you will be able to offer to people who may not obviously fall in that category of old age and chronic morbidity. So
you're saying first thing is to actually scale up the drive as fast as possible. Am I correct?
Yeah.
Do you agree, therefore, that requires decentralization? That it cannot be a top-down approach, it cannot be a tech-driven. Does the approach have to be perhaps much more localized, empower local people rather than make it a top-down approach?
I don't know what you exactly mean by top-down approach, but you actually look at the issue. No,
sir, I mean, when I say top-down, I mean the over-reliance on COVID. It almost seems as if the website and the lack of a human interface. Why can I not work it out through local dispensaries, through local hospitals much more effectively? Strengthen the walk-in process.
No, if you actually look at the guidelines that have been issued, actually it tends to mention that people who may not be able to access internet, people who are not conversant with the whole process of digital registration, they can actually walk in. They can take assistance of the hospital.
Right.
The hospitals are expected to even put up one person who will help them get on-site registration done. Now, if on-site registration is an option that they can actually exercise, right, I don't see any reason why I would say that I need to completely decentralize and let people decide whatever they want to. One has to imagine that there could be a chaos for supplies of vaccine if we completely decentralize, because you would not know how many dosages have to be supplied across unless there has to be some monitoring that should happen there.
I think you make a very good point that on-site registration is critical. Dr. Seth, will all these hospitals, private hospitals, have on-site registration? At the moment, they all seem dependent largely on the COVID site. And do you believe that the price ceiling, as some believe, should be raised because it will incentivize in a way the vaccine industry? Kiran Majumdar-Shaw and others are suggesting that 250 rupees is COVID vaccine jab should not be capped at 250 so that private vaccines are incentivized?
So let me just address 2 or 3 points here. The first point was that whether the process for giving vaccination was only clear to the private hospitals yesterday, and certainly by today, we had a person devoted to uploading for the patients and helping the patients, which is even going to be smoother tomorrow onwards. By the way, we had a rush of walk-in patients who perhaps could not get onto the COVID app for whatever reasons. And we were therefore catering to them, and that was a rush in the afternoon, which is still, by the way, was continuing till 8 o'clock to clear up. But we must also remember that every process is a process in evolution. We are talking about a process as is it today, and as you've seen for testing in the past, you've seen for other aspects of patient care of COVID disease, that process of evolution changes the process to say what is going to be in 2 weeks' time and how do we spread it out in 4 weeks' time. Because earlier, in the initial phases, remember, It's not just the number that we've got to do. We've also got to be taking care of that vulnerable patient. Perhaps he may be more susceptible to side effects. Perhaps we have got to look at him far more with care and have that observation for 30 minutes. This is the first time that vulnerable above the 60 are going to be vaccinated. Earlier, these were younger people, the healthcare workers, the frontline workers were a whole younger population who were who had less comorbid conditions. So we will go along it smoothly, we will expand gradually, and by the way, the processes will change, I'm sure, in a month's time to say, how do we accommodate more and more people? For example, let me just give you a very important example in the comorbidities. You'll be surprised. Today, when we talk about prioritization, we're talking about a patient who's had a heart attack in the past, and I'm talking about the 45 to 59 age group, who's had a heart attack in the past, is still not a candidate for vaccination. He has to have hypertension or diabetes along with it. Even if he's had an angioplasty or a bypass surgery, unless he has diabetes and hypertension along with it, he's still not a candidate. I'm sure in 2 weeks' time and 4 weeks' time, as we vaccinate more and more, this is going to actually then transfer to patients who had a previous heart attack, previous bypass surgery, all of who fall in the high-risk category, but perhaps lesser high risk than those with the same conditions along with diabetes and hypertension. So we must remember, this is an evolving field. We move along it together because we have an objective, and the objective is gradually get to the maximum number of patients possible with prioritization and with sensitivities and sensibility.
Okay. I think those are fine words, and I think there's a positive spirit. Dr. Joshi, at the very end, 30 seconds, can we say, therefore, that you are confident that particularly in Maharashtra, worst affected by COVID, in the next couple of days, we will see an exponential rise in the number of people who will be vaccinated?
Yeah, we need to get the fastest possible vaccination access and vaccination program.
And you have no shortage of vaccines, am I correct, Dr. Joshi? No shortage?
I don't think there's a shortage of vaccine.
Excellent.
In the shortest possible time to the most vulnerable group. That's the key.
Okay. Let's leave it at that. I'm afraid we've completely run out of time today. But on this segment, I think it's important to give a note of confidence. The glass half full today. At least we've now started with this critical second phase, reaching out to those who are most vulnerable. Let's hope that the many technical glitches are simply day one concerns, that it will all be evened out in the days ahead. Let's take a break, because coming up next...